we need to appreciate the effort that all three of these panelists made in preparing these points for us today and really educating us about the issue of stressors on the ocean and coastal ecosystem environments and how they relate to health. I thought I'd just lead off with a question, and then we can open things up to the audience. And I would ask to just use the standing mics if you can. I think it will be easier for me to then be able to recognize people who have questions. But it seems to me that it might be worthwhile starting with a very obvious problem, one that the National Academies has spoken on many times, which is climate change. And that time and time again, this body has been asked to review that issue of climate change, the role of human activities in that, of course, the role of greenhouse gases in that, and time again, this organization has issued reports that very clearly lay out the views of the scientific community on that. And I did see this as a thread through all three talks, and that is the profound impact not only of the changes in temperature, but also the changes in carbon dioxide levels in the atmosphere, the greenhouse gas pollutants, which directly affect the chemistry of the ocean, as well as affecting the ocean through temperature change. And I know that the National Academies has spoken on all of that before, but yet we do not manage we don't manage the ecosystem around that. We are not preparing for many of these changes, which are inevitable, and we're not doing much or enough to reduce our human contributions to this problem and to try to reverse this. And so it seems to me here we have a case where we have the science, I think, where we can understand this. We have the knowledge. We're not translating that knowledge to action, but are we missing information? Or is it that we're missing the ability to clearly communicate this information? And I guess part of what frustrates me is a sense that some of the regions of our country, certainly where we haven't clearly gotten this across, are some of the very same regions that seem to be most vulnerable. So I don't know who wants to start with that.
Well, I guess I hearken back to one of my first slides, which, from the perspective of a federal agency, reflects the will of the country to put in place the structures to deal with this as a high priority issue for the country. Many of the tools are in place. I think the amendments to the Clean Air Act were certainly a step in the right direction to look at this more holistically and more regionally than a stressor by stressor. I guess it's if you live in a climate where facts don't matter, then facts don't matter. If you live in a climate where facts do matter, then it seems obvious what we need to do. And I, for one, am, been in the business for quite a while, really can't figure it out. I just don't know. I mean, how do you get I'm sure there are brilliant people here who can figure it out. If you're going to deny facts as a scientist and being part of that culture, I don't know how you get the message across other than starting at kindergarten or something. I don't know. Paul?
I'll tell you, I think one of the key issues is persistence. And this is where the Academy can help, never losing focus on what's important to communicate. I think Linda raised the issue of the importance of communicating directly with health communities. We don't do a good enough job of segmenting our communications, our messages to resonate with different communities across the country. We need to work on that. Very much. We need to, many of us are working more in social media than we ever thought we would, particularly at the age we are now. But trying to figure out how to use those things. For NOAA, for example, with leadership by Julie Turton and others, Julie sitting back here, we have had a presence at the last several APHA meetings. Who'd have thunk that NOAA would be at APHA, but we're trying to raise these issues with nurses, for example, with emergency room physicians, because a lot of the things that we're interested in and concerned about don't manifest themselves as unexplained mortality events for dolphins do, where you have a whole bunch of animals show up on the beach dead or dying. We haven't seen that for humans yet, but we're concerned about it. And so on the climate thing, I think the question was said earlier about data. Well, we're drowning in climate data, but we're still not doing a good job of communicating. But I hearken back to what happened with tobacco. It took a long time to win that battle, and we still got a long ways to go with it. So I think persistence is a critical element, and I think having both businesses and states step up into leadership roles where it's appropriate to do so. In the ocean world, ocean policy world, we finally ended up with a national ocean policy after more than a decade of work. But when it comes to implementation, much of the leadership there has come from states. Some states are active, some aren't, but we're getting some that are. So I'm looking for region-specific examples of climate change the same way. And I guess on the business side, I was very encouraged to see a headline in Bloomberg Business report, I guess it was a week ago or so, 10 days ago, that said, "It's the climate, stupid." So I think there are some things, and you know, we in agencies do a lousy job of using that kind of vehicle or getting available to use that kind of vehicle to communicate. So persistence is number one, Lynn, and the Academy can lead that.
I guess I'd just say we have a little bit of a different perspective. There are a lot of geologists, obviously, at the USGS, and we study deep time. So we've seen what's happened to the planet for 4.56 billion years, and a lot has happened to it. There have been times in the Earth's history where the CO2 is 1,000 times plus more than it is now in the atmosphere, and so forth. So it's zooming out and seeing the big picture. But I think what we are have to acknowledge is rates of change. And we do a lot of work on geologic carbon sequestration, experimental work of what happens if we try to sequester carbon dioxide in depleted oil and gas reservoirs or saline aquifers and so forth. And one of the things that we're seeing, we do field studies, we do lab studies. One of the things we're seeing is there's a lot going on geochemically, and it's not easy to predict. So this whole idea about understanding what it is that we're doing in this grand experiment of planet Earth, when we don't necessarily understand it at the bench level, certainly we have a lot of research questions remaining.
Thank you for that. Linda Birnbaum.
Linda Birnbaum, NIEHS, and member of the Roundtable. I've got two main points I want to make, and the first really is to build off this communication issue that actually the gentleman who had spent 17 years in Vancouver talked about, which is we're not doing a good enough job of getting our message out and getting it to the decision makers. We know that that's the real problem. We can't, I agree, Paul, with the need for persistence, but we really don't with climate change have 50 years to wait until everybody believes it. If after what's happened this past week or 2 weeks ago with Sandy doesn't begin to raise the concern, I'm not sure what will. But this country is woefully ignorant when it comes to science, and part of that's our fault. I think we as scientists have a responsibility to communicate our understanding to the population and not to stay in our ivory towers. We also have to, I think in some ways, stop focusing on the uncertainties and focus on what we do know instead of what we don't, because I think we've learned a lot. The other point I wanted to make to the three of you is that you're all busy happily talking to each other about human ecosystem services and human health. But where's HHS in this picture? Which is the largest federal agencies, one of the largest federal agencies, and I often hear discussions that go on between USGS and NOAA and EPA does have a mandate to look at human health and the environment, but where's HHS in this? And I think, there's been an interesting recent example. The Roundtable sponsored a great workshop on fracking recently, and the President put out an order, and there are 3 federal agencies together looking at fracking issues, and health is nowhere in the picture. So I guess what I'm asking is you need to invite us to the table in your discussions when you talk about human health.
Paul?
I can't help but agree with you on several points, Linda, especially on the uncertainty and starting with what we know. But with regard to Health and Human Services, Chris is standing at the microphone. I will take the opportunity to note that CDC and NOAA do have some collaborations, and we do within IEHS. It needs to get broader, but the difficulties I think we all work with are these are small programs within agencies and have not gotten the level of visibility that many of us concerned about the long-term impacts think they deserve, because this whole thing of the tipping point, at some point you reach a point where things that are relatively small changes or small impacts become in the aggregate very big, and that's a concern for someone like me who spent, like Jonathan, a lot of decades working on these kinds of issues. So I agree with you. I'm not quite sure what to do, but we are beginning to work together with health agencies on some of the specific impacts, and particularly where we can bring NOAA capacity and forecasting of environmental activity or environmental conditions to the disease, to the health and disease world, where they can use that information more effectively than we can.
Linda, I can't answer your question. Just an observation that even with, you understand that within even our own organizations, we have cultures that tend to look within their own stovepipes. And one of the encouraging signs I've seen, though, is that we're beginning to see the importance of systems and viewing this issue of climate change, but also the rest of the way we govern as from a systems perspective. And of course, as a card-carrying systems ecology, it's like, duh, but it's difficult because there is so much detail, so much to learn, and such power in reductionist approaches, both to how we govern, but also how we study the world, that it takes a huge effort to put those systems together, even within our own disciplines, and then looking across agencies to say these parts are connected and we need to have those people in the room. I mean, if the people need to be in the room, then let's get the people in the room and start putting these systems together. So, some people see frameworks as a distraction because there's not enough detail. The tobacco issue was good because there was an adverse outcome pathway that you could follow, right? Well, these problems don't quite have that linearity to them, and it's understanding this non-linearity in the systems perspective that I see progress being made. Everybody has to do it. You just can't let somebody else do it.
Thank you for that. Okay, we have two.
Can I just make one comment of good news, is that there has been an addition of a human health piece to the work in hydraulic fracturing. OSTP and OMB asked to see the three agencies in the MOU there, DOE, Interior, USGS, and EPA, to support the executive order. We laid out a research plan. It's in draft form now, and while it's a bit of a late entry, there was some interest in saying, what can we do for socioeconomic and what can we do to link it to the human health, which was more than we had some months ago.
Well, I'm very aware of that.
Yeah.
However, we were explicitly not at the table. We could provide background information, and that was from the department level. And I think that that is a loss as we go forward. And I just think that we all have to be committed to making sure that all the appropriate people are involved.
I'm going to move to the next question. Chris Portier.
So I'm going to take us back to ecosystems and away from climate change for a minute. So I'm really glad Haiti came up as an example, because Haiti's not a climate change issue. Haiti is clearly an ecosystem services failure. And when you compare Haiti to what's next door? Dominican Republic, thank you. I had it a minute ago. You can see it. It's so patently obvious. Why are we not pushing this? Now, if we look in the United States, where are we seeing ecosystem failures on the large scale, and why aren't they out there for everyone to see? What's the root cause of us not being able to do this? And I think part of the root cause, and what you haven't talked about, because you're all federal agents, but not everybody here is from a federal agency, is the structure in which we find ourselves on policy decisions and regulatory decisions in the United States. Land use issues are inherently local. Issues that we're talking about in terms of ecosystem management can go much larger than local. If you look at Texas and the drought, you look at what's going on in development in the Southwest. If you look at many of our coastal communities, these are not localized issues. Atlanta alone, where I live, where CDC is, I'm Chris Portier from CDC. Atlanta alone has over 20 different water districts managing their drinking water. Can you imagine this one source, one big lake, 20 plus water systems, and then downstream from us, we're affecting ecosystems tremendously. How do you build a structure today? Because what has happened is we've built our policies in the United States over hundreds of years. And we've never sat back and looked at it, except on occasion we have the creation of the Environmental Protection Agency, Clean Water Acts, Food and Safety Acts that came in decades earlier. All of those were big changes in where we're going. Today, right now, what do we need in the United States that's going to take us forward and protect us from this very changing structure of systems of systems of systems of systems that we're facing? We don't seem to have a regulatory framework for it, or a policy framework that grabs it all. So where do you think we should be going with that?
Well, the Haiti Dominican Republic story, I mean, it's a great example, but there's a richness, and I've read Collapse, you've all read Collapse, where you have a dictator who says you can't cut the forests, right? I mean, that's how you do it. Which, of course, we're in a democracy, and that's not going to work. My sense, then, to get to your question, is what do we have to do, is I think we have to stop looking for a magic bullet. I think there are lots of things. Almost everything we do as parents, with kids matters in creating an environmental ethic that will eventually, with the persistence, and I think patience and persistence are important, although the urgency, particularly with respect to some of the stressors that we saw, climate change among them, is now getting pretty severe. There is no one thing, and I would caution certainly away from thinking that there are. There is probably a myriad of things that we can do both within our private lives and our public lives to move this along. I think my personal view is we need a new environmental ethic, and we need to keep pushing that. That's a whole other discussion, but that's where the new laws are going to come from. That's where the political will in a democracy are going to move us along. We'll lurch from disaster to disaster, along this path, but that's my own view.
We are moving, we've moved into the time for a lunch break, but we have one last person at the mic. I'd like to go ahead and give you a chance to ask your question, and then we can respond to both questions if people.
All right. So I'm Julie Turton, and I'm from NOAA. And it was a great setup for the ethics question. I was going to ask and commend the panel for tackling this and actually bring together the previous conversation on cultural and ethical values and how we communicate this, and ask the Academy, sort of Paul's point about persistence and the role of this roundtable, I think is pretty pivotal, because you're in a position where you can actually help keep the pressure on and articulate the role of both the needs for being strategic about who and what we communicate, as well as how to help organize at different levels, including the federal agencies involving the industry. So I wanted to ask, in terms of the roundtable, maybe it's for the discussion to wrap up tomorrow, but as institution that is uniquely positioned to help keep this momentum going and help generate the political will and maybe change the ethics and values about this. What would be an appropriate role for the roundtable to help the federal agencies work together more efficiently, but also get to some of the valuation issues and the communication issues, because those are really huge stumbling blocks in this area. So it's persistence, but it's persistence and some dedicated effort to keeping the research agenda going, developing communication, and actually figuring out how to keep this going over a period of time to get the political will a little different, and that will affect all of us. So opportunity for the
I might
academy.
start with that. I think that these two things that you mentioned in terms of the role of better valuation, better use of economics, and also communications are areas that, directions that the Roundtable has been moving over the last several months, and directions that seem to crop up again and again and again as being important issues that we haven't been fully factoring in what we know about human behavior, whether it's in the economics arena, in the marketplace, or individual behavior, and that is part of the problem. I was also very intrigued, actually, by Dr. Portier's suggestion that, this, and I don't know if he meant to take it this far, but I do think the Roundtable could have a role in this, which is that it might be time to begin to have a fundamental reevaluation of how we do environmental protection in the U.S. That the structures in place today, which were put in place in the 1970s, were put in place during a time where we had a very different kind of knowledge base about environmental stressors. We had a very narrow definition of environmental health and a very narrow idea of what things about the environment impacted health. And frankly, we were dealing with some very visible problems like rivers on fire. And it could well be that we could benefit from taking a very careful look at that. I've also heard that from people, not scientists, people who are in the regulated community, that there are things about the way the current system works that make them unhappy. And it has been quite some time now. And so maybe it's time for that, and maybe that's something that we could help to catalyze. But I don't know if there's any final comments from the panel before we break for lunch. Paul and Jonathan?
Well, I certainly agree with what you said, and I think that all of us, whether it's the work group here or other work groups, need to think that through. I did want to pick up one thread to leave you with, which is this notion of certain things being monetizable or not, and in particular those things that traditionally have not been monetized: the spiritual, the ethical, the aesthetic. And I want to caution folks that may be true for classically trained economists, just like classically trained toxicologists may not want to go into the world in which there are multiple interacting stressors, and yikes, that's really tough. But I think we want to encourage the development of those fields of valuation in which those are not unreachable goals. We have developing disciplines, both in economics and in the social sciences, where those are not foreign concepts. They may be incompatible with some structures within classically trained disciplines, but not necessarily in the future. And I wouldn't just write them off and say we shouldn't or couldn't value them. I think we must, and we have to encourage the development of those tools.
All right. Okay, so it's time to break for lunch. Christine, do you have instructions for us about that?
Just to let everybody know, the speakers and the roundtable members were back in the rooms we were in this morning. And for everyone else, there is a cafeteria here at the academies, and we will have staff actually out in the hallway who will help direct you to that area.
And thanks to Christine and to Erin and the rest of the staff who helped to organize this today, by the way. Have a good lunch.
Nice to meet you.